Dr. Kathleen Fuchs is here from the neurology department at UVA. We're going to talk about ways we can keep our minds young during the aging process, which, you know, we're all going to have to deal with that. And first off, you know, one of the biggest things that people see now are all these commercials for websites like Lumosity and some of these other websites that have these brain games that say that can help you stay sharp.
Well, they are a little overstated somewhat in their claims. We do know that when people do activities like these brain games, they get a lot better at the games. Does that transfer into everyday life? We're not really sure, and in fact some large studies have shown that the effect is rather minimal. But I will say that when people do these activities and they get better, they're more confident in their abilities, so they may approach their real-world activities with a bit more confidence and therefore do a little bit better. But for me, I think the bigger bang for the buck is to get out and exercise, because studies have definitely shown that people exercising in their mid-20s do better when they're in middle age, and even when people start in middle age, they do a lot better and they're less likely to develop dementia than people who don't exercise regularly.
And you don't have to be at a CrossFit gym or anything like that. What kind of exercise do you recommend for people who, say, you know, are in their 50s or 60s and they're just getting started?
Right. Well, certainly you would want to consult your doctor if you're just getting started and have been sedentary. But most studies will tell you that any exercise that you can do that brings up your heart rate, but you can still carry on a conversation, is good. So walking and walking with other people is very effective. And in fact, one study coming out of, I believe it was the University of Pittsburgh, showed that people who walked as little as 6 miles a week did better down the road, not only cognitively, but on indices of their brain health, like MRI scans showing their brain atrophy or shrinkage was a lot less than people who weren't exercising. Just 6 miles a week.
Yeah, and this isn't just about your brain function, it's also about your emotional outlook on life and everything.
Absolutely, absolutely. Regular exercise can support your mood, and we know that sometimes depression can lead to an increased risk of things like Alzheimer's disease, so it's important to support that as well.
And also, what about, you know, we talked about the Lumosity, so, but what about like crossword puzzles?
Right.
I've read where that's a good thing to keep your mind active.
Again,
is it that same thing?
It's a good way to stay engaged and stay active. It doesn't really lead to improvement, because a lot of times when you're doing well with crossword puzzles, it's because you already know a lot of words. But it's certainly not a waste of time. It can be good. But I would say if you're doing a lot of that, think about what you're not doing. And what you're not doing maybe is getting out and exercising and socializing with others.
Time to hit the pavement.
Absolutely.
All right. Dr. Fuchs, thank you so much for being here today.